Multitest 2 is a sterile, disposable, multitest head applicator used to administer skin test substances. The small size and interesting appearance of the Multitest 2 applicator eliminate needle fear common in allergy testing. The applicator provides the user with a quick, convenient, and standardized method of applying allergenic extracts and controls at 8 evenly spaced test sites. Multitest 2 standardizes skin test application from site to site and from user to user, depositing uniform amounts of allergen at each site for highly reproducible results. Reading is easy. The test and control results are reliable because they are both applied at the same time and in the same manner. The compact Multitest 2 system consists simply of a sterile, disposable applicator with 8 test heads, the dipwell tray and protective cover, and this convenient recording form. Following is a step-by-step demonstration of how to use the Multitest 2 method of skin testing.
The dip well tray consists of 24 wells arranged in 3 sets of 8 wells each. The 8 wells are numbered 1 through 8, and each set is identified by letters A, B, C, and beyond. Prior to use, individual skin test solutions are placed in their designated and numbered wells of the tray. First, carefully remove the sterile tray and its lid from the package, keeping the lid over the wells until they are ready to be filled with skin test solutions. These trays have been designed to stack one on top of the other to conserve refrigeration space. A note of caution: when you are separating stacked trays, be careful not to pick up the lid from the underlying tray. Immediately prior to filling the wells, identify each set of 8 on the etched rectangular areas at the bottom of the tray with the letters A, B, and C. If you are going to use more than one tray, label the additional sets of wells D, E, and so on. A master recording form is used to identify the names of selected test solutions and their corresponding well numbers. The individual test solutions are placed into the wells so that each well contains the test solution that corresponds with that test solution's well location number shown on the recording form. As you place the solutions into the tray wells, the name of each solution will be next to its well number on the recording form. An example of labeling and placement of extracts and control solutions would be to place the positive control histamine in well A1 and the negative control glycerylsaline in well A8. Wells A2 through A7 would contain allergenic extracts. This approach would be repeated for wells B1 through B8 and C1 through C8. Dispense the desired amount of each skin test solution into its properly identified and numbered well. A 5 milliliter vial dropper completely filled 4 times without air bubbles provides approximately 1 milliliter of allergenic extract or control solution for each well. Remember, always take care to prevent air bubbles from rupturing or droppers from dripping over the tray surface. Each well must contain at least 3 full drops at all times to allow complete submersion of Multitest 2 points in the test solution. Never fill wells with more than 1 milliliter. 1 milliliter of solution will provide more than 100 skin tests. When the wells are filled and you are ready to begin testing, remove each sterile Multitest 2 device from its container by grasping the sealed label at either blue dot and pulling it off. Point the blue dots away from you to position the device for easy removal. Align the concave portion of the T-bar with a tray guide post and lower the handle of the device between the 2 guide panels, allowing each test head to enter its respective well. Note that the applicator is designed to fit into the tray in only one position, preventing you from accidentally inserting it incorrectly. Test head number 1 will always enter well number 1. Test head number 2 will enter well number 2, and likewise for all numbered test heads and wells. Now select the test sites. Be careful to choose sites that offer sufficient surface area and adequate subcutaneous tissue for uniform puncture by the points of each of the test heads. The preferred sites are the volar surfaces of each arm and the back. Skin of the posterior thighs may be used if necessary. Avoid hairy areas whenever possible, as reactions are much more difficult to interpret in these areas. Cleanse sites with a suitable disinfectant and allow to dry. In order to distinguish one test area from another, make an identification mark on the skin where the T-bar end of the testing device will be positioned. Use a marking substance that is safe and that will wipe off easily with a solution such as alcohol. When you are ready to proceed with testing, remove the lid from the dip well tray and place it topside up on your work surface. The bottom of the dip well tray will now fit over the top of its own lid. Remove the loaded Multitest 2 applicator from the tray. Be sure not to touch any part of the tray with the loaded Multitest 2 points. Position the T-bar end of the applicator near the identifying test area letter and toward a constant reference point, such as the head of the subject being tested. This will greatly reduce any possibility of incorrectly identifying the extract applied at each test site. Press the loaded unit into the skin with sufficient pressure to allow adequate penetration of the points on all test heads. With proper pressure, a distinct puncture pattern from the points will be observed at each test site, and bleeding will rarely occur. If the skin is taut, less pressure is required to gain proper penetration of the points. In some cases, the contour of the testing area may be such that a slight rocking of the applicator will be required to gain adequate and uniform penetration of all test head points. Note, check each test site to make sure that adequate point penetration has been achieved. Particular attention must be given to proper penetration of the points on test heads number 4 and number 5 when the volar surface of the forearm is used. These two test heads will be closest to the wrist over an area where the contour of the forearm narrows. You will develop a feel for using Multitest 2 after just a few applications. Now discard Multitest 2. Do not reuse. Discard in accordance with all local, state, and federal regulations.
Looking directly at the test site area, the results of the test can be read in a clockwise manner, starting at the upper right-hand corner of each battery of 8 tests. At the upper right is test site number 1. It will always be in the 1 o'clock position. Proceeding in the clockwise direction are test number 2, number 3, and so on through number 8. These test site numbers, as we have shown earlier, correspond to the well numbers on the dip well tray. This identifying system using numbers and alphabet letters helps to eliminate any possible confusion when reading and recording test results. Because patients differ in their responses to mechanical and chemical stimulation of the skin, interpretation of skin test results are most reliable when positive, histamine, and negative, glycerosaline, controls are used. It is recommended that testing be conducted so that positive and negative controls are applied at the same time and in the same general location as the diagnostic extracts. The response to histamine, 1 milligram per milliliter, is considered a 3+ reaction, while the response to glycerosaline solution is considered negative. The diagnostic extract test sites can be graded against the positive and negative control sites. Reading of positive control results is conducted 15 minutes following administration, while reading the results from negative controls and diagnostic extracts is done 15 to 20 minutes after their administration. However, positive reactions to diagnostic extracts can occur up to 30 minutes following administration. Note that the use of histamine, 1 milligram per milliliter, as a positive control also provides information as to whether or not the patient's ability to react adequately to diagnostic extracts is being impaired by their use of drug products or other causes. The following are typical reactions to the Multitest 2 that must be graded according to specific criteria outlined in the Multitest 2 package insert. Grading standards for other testing techniques are not applicable to Multitest 2. Negative. no wheal or a wheal no larger in size than that produced at the negative control site. Erythema absent, or the area of erythema no larger than the area of erythema occurring at the negative control site. It should be noted that all scratch, prick, and puncture type instruments do, on some patients, cause a wheal or erythema, or both, at the negative control site. With some patients, wheals 2 to 5 millimeters in diameter, with or without erythema, will occur at negative sites due to irritation of sensitive skin. These responses usually subside within 20 minutes, and there is often residual erythema. Any reaction equal to or less than the negative control is classified negative. Reading all reactions against negative control is imperative. Wheal reactions from histamine at 1 milligram per milliliter, 1 to 1,000, in adult subjects will usually range from 7 to 9 millimeters in diameter. In some patients, the wheal will be slightly smaller or slightly larger. Unimpaired histamine wheal reactions in young children will sometimes not exceed 5 to 6 millimeters in diameter. Wheals with diameters less than 5 millimeters, resulting from pollens and other inhalants, rarely correlate with symptoms of allergy. Wheals with diameters 5 to 6 millimeters resulting from pollens and other inhalants may or may not correlate with symptoms of allergy. Wheals 7 millimeters or larger in diameter resulting from pollens and other inhalants do, with a high degree of frequency, correlate with allergic symptoms. Well-defined pseudopodia indicates a high degree of sensitivity to the test allergen. For complete information on reading and interpreting multi-test 2 results, the user should refer to the package insert. A positive skin test reaction to any allergenic extract must be interpreted in light of the patient's history and physical examination. Test results from multi-test 2 can be conveniently and quickly recorded on specially designed multi-test 2 forms that are available on request. Before employing allergenic extracts with multi-test 2 or any testing device, the user should be completely familiar with the information contained in this video, as well as that contained in the accompanying package inserts. After seeing how fast, easy, and convenient it is to use multi-test 2, we hope that you're enthused about this major advancement in skin testing. We invite you to call one of our representatives at the following toll-free number with any questions you might have. Thank you.